BiPAP is a small machine that connects to a mask. The mask fits over your nose and mouth. The machine gently pushes air through the mask and into your airway and lungs. The BiPAP gives a higher pressure when your loved one breathes in and a lower pressure when they breathe out. This keeps your loved one's airway and lungs open, allowing them to take bigger breaths. BiPAP not only aids in regular breathing, but also reduces the effort required to breathe, which can be particularly beneficial during sleep. This relief can improve sleep quality and more stable health conditions, making it an integral part of daily life. You may use a BiPAP machine if you have certain ongoing medical conditions or an emergency that requires assistance with breathing. Providers can treat the following conditions with BiPAP: heart failure, COPD, OSA, respiratory failure, neuromuscular conditions like ALS, muscular dystrophy, etc. Any condition that causes carbon dioxide to build up in your blood, and you can effectively get rid of it when you exhale. How long you're on BiPAP depends on why you're on it. Unless you're treating sleep apnea, most people are only on BiPAP until they can breathe well enough on their own again. BiPAP isn't life support and doesn't completely take over breathing for you, unlike the ventilator. If you need to be on BiPAP for more than a few days straight, you need to be able to take breaks. This means either breathing without a machine or getting extra oxygen through a small tube cannula just under your nose. If you're on BiPAP for sleep apnea, you can use it at night indefinitely. Benefits of BiPAP include: it's non-invasive. This means it doesn't need to be inserted inside your body. Non-invasive ventilation has fewer risks than invasive ventilation. It can help to transition you off a life support system. BiPAP is an alternative to CPAP in people with sleep apnea who can't tolerate or who aren't getting better with CPAP. What are the risks of BiPAP? A provider can't give you BiPAP if you're not breathing on your own, or if you have issues with aspiration or managing your secretions. BiPAP is uncomfortable, and you or your loved one might not be able to tolerate it for long periods. The mask can make some people feel claustrophobic, trapped, or closed in. Excessive pressure can cause lung injury, although this is rare, and some devices or masks have safeguards in place to prevent it. It can cause low blood pressure, aspiration pneumonia,